Who knows what Jay-Z, J.K. Rowling, Bill Gates and Oprah Winfrey all have in common? Okay, I will tell you then. They have all overcome failure in one shape or form to go on to gain success in their respective careers. Welcome to My Perfect Failure. Join us as we delve into the world of our perfect failures. We will interview, explore, and discuss how our perfect failures can lead us to success. Join us and tune in.
Welcome everybody to another episode of My Perfect Failure. Today we have another fantastic guest for you. So my guest today is a board certified integrative medicine physician and host of the Health Conscious Living podcast. She is retired from a private practice where she helped patients with complex medical conditions progress from illness and pain to health and well-being. After surviving a high-impact collision and near-death experience in 2011, she is passionate about sharing her 5-year recovery journey from crippling pain and disability to a full recovery. So, a very, very, very warm welcome to My Perfect Failure, Dr. Gayle Myers. How are you?
Thank you. Oh, it's great to be here, Paul. Thank you so much.
Well, I'm delighted to have you on the podcast. Congratulations on your recovery first and foremost. So we'll talk a little bit about that. But I'm really keen to understand really about how you managed to navigate such a difficult period. What I'd be keen to get into initially, if that works for you, just as a little bit about you, your background. I think there's a medical background there, maybe how that came about.
Yes, and it's interesting because I've always had this complex relationship between science and spirituality. So my background starts as in science. My father was a doctor, and I knew from the age of 7 that I was going to be a doctor because I would read his medical texts.
Really?
So I knew that was my journey. Yes. I mean, how many 7-year-olds read medical texts?
That's what
But I
thinking.
did, and it was really, I enjoyed it. So I continue in life, and I studied science my entire life. But at the age of 13, I started having these experiences. I would dream of that I would meet someone, and then I would meet them. And it kept happening. And then I would dream of a situation and it would happen. And that continued. And this was the 60s, and I had no one to talk to about it. Meanwhile, I continue to study science. And at the age of, that was 13, at the age of 21, I started seeing auras. I started seeing the electromagnetic field around people. And I thought it was just my nearsightedness. You know how everything looks blurry when you take off your glasses?
Yeah.
Except that or my contacts, and I had my contacts in. So it kept happening. And so that really put me on this path to study and read and learn everything I could about spirituality, that there was something more that was going on than the science. And I studied botany at the time. I studied it with a passion. I studied wetland ecology in my master's degree, and really studied about how all the different ecosystems and parts interact. And so I loved it. But there was this calling from my childhood, my soul's calling to go to medical school. So I went to see a psychic who held my hands, and she had never seen me before. She held my hands and she said, "You're going on for more schooling." And I said, "No, I'm not." She said, "Yes, you are." And I said, "No, I'm not. I've had it with school." She said, "Yes, you are going on for more schooling, and don't disregard your medical background and let your father help you." My father was a doctor, and he always wanted to see me become a doctor. But I had become a little bit disillusioned and fell in love with botany. And so I realized at that point she had said hello to me, to my soul, and to my journey, my soul's journey. So I knew at that point it was time to go to medical school. So I did. off. I went to medical school, but I kept studying. I kept reading everything I could about spirituality. And then at that point, yoga was just starting to come on to the scene. There wasn't a lot going on with that. So I would study and meditate. I studied with the psychic that I originally met and learned how to meditate before I went to medical school. So that kept me as calm or calmer as I could have been during those really challenging years of going to medical school and my training. And things kept happening to me in relationship to patients that would just keep showing me that there was so much more to us than just the body. Like there's more. And so I went on and went into private practice. When I first started my private practice, I realized that the people who were the healthiest that came into my practice were exercising, they were sleeping, they had full lives, and they weren't taking either very few medications or none. And so I started noticing, like, okay, what is this? So I need to study this more. And that really started to take me into my integrative medicine practice. I learned something early on because of my own head and neck pain called biodynamics of osteopathy in the cranial field, which is a hands-on treatment that treats the nervous system and the musculoskeletal system and the body as a whole. And it was so effective, and it was something that I did with great skill. And I did it, and I studied it for over 35 years. So you put these all together, and I started. So in my practice, I had a patient that came in and said, "You should read this book. It's called You Are the Answer." And I said, "Okay." And I started reading it, and by Michael Tamura, who just recently passed away in October. And I started reading his book, and I remember thinking, this man knows how to talk to people's souls. I want to meet him and I want to study with him. And 2 months later, he was in Vermont, and he had
Wow.
never been to Vermont. So there I went, and there he was. And so he started talking about grounding and a grounding cord. These are visualization meditation techniques. And now I had been studying about the energy field, the energy field and the chakra system and all of this while I'm a doctor and I'm doing medical. I'm an internist by training. I'm doing a combination of conventional medicine and what was considered then alternative, but really holistic medicine. And now it's called integrative medicine. So integrating the foundation of allopathic medicine or internal medicine for me with other modalities to help people heal, recover, and have optimal health. So I learned about this grounding cord, this grounding technique that day. And I remember him saying, if you could see what I can see, you would not think of not taking a shower for 40 years. So he could see the energetic field, and he could see where all the places were. We could call them our memories that keep us from really progressing, that we hold in our minds, that keep us filtering how we create based on past experience. So I was fascinated. That was it. I had to study with this man. I'd waited 30 years. He had been a nurse, and so he understood the electromagnetic field. He understood spiritual anatomy, and that's what I needed. I needed someone who really understood spiritual anatomy that could help me integrate it with what I knew in medicine and osteopathy. So that was the beginning of my journey. And so I studied very intensely, let's say. I was a very good student. And he said, practice your grounding cord, which is a visualization tool. It's a tool. So the visualization, first of all, you say hello to your inner light, right? Say hello to spirit within. and say hello to your body and say hello to source, that which gives all. So you are aligned. And then the grounding is simply envisioning a big tree trunk or a big tube to the center of the planet from just above the tip of the tailbone in the first chakra. And that is an energy processor that helps to stabilize the whole energy field. And it helps to neutralize other energies. So other people's thoughts, emotions, opinions just drop off. So isn't that nice? You don't have to be like, we don't have to be affected by everything that's like surrounding us, coming at us. And anything we're ready to release can just go down the grounding cord, just drop it. Like, like with a dog and drop the ball. It's like, drop it. So I started studying this, and he said, make sure you practice your grounding because you never know when the Mack truck is going to hit you. Oh boy. So that day in 2011, it was a very snowy day, extremely big snowstorm, like 3 feet of snow. And I was driving back from an appointment that I had with my bookkeeper, and I could see this man coming. I was going south on the interstate very slowly. He's going north, weaving in and out of lane, and he was going way too fast. And I knew he was going way too fast. And I remember thinking that. And as his truck approached my car, his front tire caught, and the truck was literally sucked into the median in the snow, just like a magnet, just sucked him right in, and across the median he went. And I knew I was going to be hit. There was no way out. And so I did my medical thinking, first of all. And I said, well, because there's no time to, like, this happened so fast. I said, I'm not going to slam on the brakes in case there's someone behind me, which there was. And I didn't want to have a rollover accident because I knew what that would do to my body and my system. And I didn't want to have a T-bone accident, or we wouldn't have this conversation. So I took my chances, and I became extremely grounded. That grounding cord was probably the size of a football field. It was ginormous. And I'm driving along, and I'm present. I'm totally present. And I'm watching this happen so fast. And all of a sudden, Paul, as I'm driving along, my physical body and my energy field became a field of golden crystalline light. And I was pure consciousness, and I was at peace. I'm driving along and I'm watching this, and I'm thinking, this is really different. I knew something had really shifted for me in terms of my consciousness, but I was at peace, and the impact happened, and off the road we went. And I realized I survived. It's like, I'm alive. And the first thing I did was I said, I can move my hands. So they're okay, because I make my living with my hands, and my feet were okay. But everything else had a extreme whiplash. It was recorded more or less at 105-mile-an-hour head-on collision impact.
Wow.
So 3 things happened at that point that were the real life-changing moments. The first thing that happened was I told my body, I remember very consciously as a soul communicating with my body, I'm in this with you. Unless you die on me, we're going to heal. The second thing that happened was I forgave him because I didn't know if I was going to make it, because all the impact went into my chest. The third thing that happened was that I knew the person I was the second before the accident and the person I was in that moment were 2 different people, and I could never go back. And if I tried to go back to that person I was the second before the accident, I would just suffer. So everything was new.
Can I just interject slightly? So fascinating story, by the way, for so many different reasons. But just point of curiosity. So the person that you were before the accident and the person that you became post accident were different people, and you couldn't go back. Can you expand on that? I'm very curious around that.
Absolutely. The person I was before the accident had been living a full bore life. I had a full practice, loving husband. We did a lot of traveling. I did a lot of hiking and skiing, and I did high intensity interval training and weight training, and I had been extremely active. And then I literally couldn't raise a glass of water. It was
Okay.
so, I had so much ligament damage, and there are over 900 ligaments in the human body, and almost all of mine were injured. And ligaments have very, very little blood flow. So they're very slow to grow. So if you've sprained your wrist or sprained your ankle, you know that it's, takes some time. This was my whole body. So everything, the pain level was something like I had never, ever experienced anything like it. And it was 2 years of extreme pain. So I knew that I wasn't that person. And if the day that I couldn't lift a glass of water or walk up a flight of stairs looked like I was going to climb, a huge mountain, I knew if I tried to grieve that person that I had been before the accident,
Okay.
it wasn't going to help me. So everything had to be new. Everything had to be a discovery. And I was in such a different, it's like the pandemic. One day we're living life, and the next day we're living at home.
So
And we're not supposed
do you
to.
think it was everything that happened prior to the accident? I forget the chap's name, the guy that wrote You Are the Answer, and your medical training and your spiritual, I guess, awareness. Do you think that all those things fused together to kind of help you navigate, which I guess you couldn't have predicted this, but they supported you during this period?
Absolutely. That's a great, profound insight, Paul. It's true. I pulled everything I had to get me through that, because I knew if I collapsed into the trauma, and the PTSD was extreme. When we have trauma that happens to us, it happens, and we'll have the memory of it. We'll have the emotional memory of
Mm.
it. We'll have the physical memory of it. But to get in a car and have to drive was intense. I would have times when I would just be shaking all over so much, and I would ground. I would use that grounding cord and remember that I can release this fear. I can release this pain, and I can bring in a beautiful golden sun, the infinite abundance of my divine essence, and reset calm, for peace, for clarity, for for confidence, that I
Mm.
trust that I can make this. So I really pulled everything I knew at that time. And the thing that was really challenging as a physician was that as a physician, I knew that my full recovery was not guaranteed. So that's where the mindset came in. I really had to stay positive.
Yeah.
And there was one moment in the emergency room. So I was released from the emergency room 3 hours after they took me in. They were like, "You're
Sorry?
okay."
Three
I
hours.
know.
Three
I
hours.
know. 3 hours. They're like, "Okay, your knee's injured. Put a knee brace on. We did your x-rays of your neck and you're fine." Well, then the pain really started. That's when all the shock started to wear off, and the pain just was incredible. And so that's where I also had to use the meditation to really like find the point of stillness in all the pain, so
Mm.
that I could just, and then find a balance point for my body that was the least painful. So that's how I would start to navigate. Now, I did physical therapy, and I did incredible amounts of rest. I had to go on partial disability for a couple of years. But I did things that I knew that I had to feed my body everything it needed to heal. So my focus was healing. And now that was a change, because before the accident, doctors, for the most part, like military and firemen and people who work in a physical, demanding world, uh, profession, are trained to override their bodies, right? And we all do it. And so we're trained to override our needs But that stopped that day. I was like, no, I'm listening to my body. So I would put my hands on my heart and say, I love you, body. What do you need right now? And listen. Most of the time it comes in one answer. So that's one of the simplest things people can do. Just ask your body, what do you need right now? And most people hear the word rest or quiet or, or take a walk.
Is there a technique? So I'm thinking for me and people listening, or there might even be people listening or watching, that it might not even be them. It might be they might know a work colleague, a family member, or or a friend that might be dealing with difficult moments. So the question around, which is a wonderful insight around listening to our body or listening to what I guess intuitively we might be thinking. So for people that are listening, that are watching, is there a sign in terms of, oh, how did I get to the point where they can trust and go with those intuitive thoughts that they're hearing?
That's a great question. Let me just give you a little backup before I answer that. I went on to teach. I had been teaching a little bit. I'd been teaching professionals these tools called intuitive, at that time, calling it intuitive tools for everyday use or for professionals. And so listening to your intuition voice, most people think of intuition as the feeling, like a gut feeling. And that really is, that's the second energy center, the second chakra that has to do with feeling reality, called clairsentience. And then there's intuitive knowing, which is a higher level of knowing, intuitive knowing, that is just the answer comes. Usually it's one word and it's right. It's just, you just know. Now, that's when the analytical mind jumps in and starts to argue with it, right?
Yeah.
Oh, yeah, no. Listen, it's always right. And it may say or guide you to something like you're uncomfortable with, like it's out of your comfort zone, but it's not going to, it always is taking you in the right direction for where you need to go. So there's a moment of, I find it to be very peaceful. It's very direct here, and because there was, an accident or something, the reason why the road was under construction or something, that you don't turn down that road. So it's a listening. It comes in a quiet, still voice, but it also can come in really loudly.
Okay. And we can take heed from those moments. So I was just thinking about you with everything that you'd developed leading up to that point. Obviously, your career and spiritual insights and the mentorship that you received. So when you were on your journey post-accident, recovering, implementing all these different strategies that you picked up over the years, did you kind of develop a system, or was it quite intuitive about you did what you felt was right on a particular day in the various tools that you used to heal yourself and help you recover?
That's a great question. All the above. I guess my system was really listening to what we would call our higher self, that intuitive knowing to direct me. I listened to my body, like, what do you need to heal? So people would say, try yoga. And yoga can be really healing. But when I tried yoga, it was the worst thing I could do because my ligaments were so damaged that if I were to stretch them, they would become more disrupted and I would get worse. So I had to, there were starts and stops. I did a form of physical therapy called postural restoration that I had done before the accident, but now I knew that if I was going to heal, I really had to focus on this every day and work with my body. So what I kept doing was envisioning my healthy body.
Okay.
And envisioning the day that I could ski again would be the day I knew I'd recover, because that requires all the ligaments working. So I just kept taking it day by day, step by step, and there'd be setbacks. And one day my physical therapist, I was really discouraged, and she said, Gayle, setbacks aren't always setbacks. And I said, okay. And I sat with that, and I realized, of course not. These are ways to regroup, reset, and then do something different, learn something different, come out with a different awareness, and come out stronger. So that's where the resilience came in. And like I said, it was all new. I had no way to navigate all the different aspects of how I was healing and recovering, but I kept the meditation as my foundation. Like if I could connect to myself as a spirit, if I could connect soul to body and listen to the body and nurture the body and bring love in that relationship, I would be okay. And so what happened, which was to me one of the biggest miracles of the whole journey, was that I began to learn early on that everything I needed would be brought to me. It's right there. So let me give you an example. My physical therapist said, okay, Gayle, I want you to get on the floor and do these exercises. This was early on. And I said, that's great. I can get on the floor, but I can't get up. I can't put pressure on my knee because I had a damage to the knee. They said, don't put any weight on it. I couldn't, and rolling over and moving with my whole rib cage was really a challenge because everything hurt, everything was damaged. But I found a way to get one position and take my whole body and rotate it so that I could lift myself up. And I began to see that if I just pay attention, if I just look around me, what I need is right here. And then it kept happening. And it was just really, to me, the biggest miracle of all, that to walk away with that kind of trust. My body learned to trust me, and I learned to trust life in a new way.
Yes, it's fascinating. So I'm thinking about that connection to the spirit, our body, how how we can get them working together. Because I'm going to hazard a guess and think that a lot of us, you teach this and educate people around this, so you'll have a better vantage point than me. But I'm imagining that a lot of us don't do this readily. We're not even aware how to do it. So I'm just thinking for people that, because I can't think that anybody that wouldn't want to actually, I've used this word a bit, fuse those elements together. Is there a starting point where, for a layperson, where we can begin to think about how we can do that? Clearly, listen to your content, which I'm going to put on the show notes and so forth. But is there a way that we can maybe start to think about how we can marry those elements?
Absolutely. And it's really simple. It's hello. Saying hello to spirit within, saying hello to your inner light. And if you try that and you start to do that, when I first started and doing that, there was a moment where that inner light said hello back. That's amazing. So that hello is the hello that heals. So when you say hello to your inner light, to spirit within, that hello is the validation of wholeness, because spirit is whole and undivided. So what I learned in my journey and what I share is that when you heal from your spirit, and remember, hello, it starts with hello.
Mm.
When you heal from your spirit that is whole and undivided, you heal your body and your life, because we're really whole. We have these experiences. So we're spiritual beings on a human adventure. and to learn, to grow, and to gain wisdom and to share our gifts with the world. So when we start to recognize that part of us that's whole, then the parts that are separated, the parts that feel separate, the parts that feel injured, the parts that feel disconnected can start to remember that that wholeness is always there. It's never going to leave. It's always there because we're spiritual beings and we're whole. So that piece right there, I mean, a lot of people would say, "Oh, that's so simple." How can it be that simple? It is that simple. That's the beginning. That's the starting point. And then you can go from there and learn all kinds of different tools to work with your energy field. And so the minute you start to do this, and the minute you start to, one of the greatest benefits of using these tools is to be able to neutralize memories, because we hold our memories as digital images in our minds. And so what happens is that it happened in the past, and we don't really have a problem with the happy memories. It's the painful ones. So we put them back here because we're living our life and we're moving on, but it's back here vibrating, and everything is energy. So what happens is something happens in present time, and that picture, that filter is right there because we match it in present time. That memory gets either triggered or reactivated. Oh yeah, that happened. Therefore, because the way the brain is wired for survival, the amygdala, it's going to keep us safe. And so it keeps us in that past memory of how we survived. But it's not necessarily where we need to be today to be productive and creative and healthy. So these tools help you to neutralize, just like the dropping it down the grounding cord, just like seeing it as a colored ball of light and dropping it, letting it go, because it can release, it neutralizes. And when we let go of holding on to what was limiting us, then our creative energy comes back to create something new.
Okay.
So that I used a lot during that healing process, and I use it every day.
But just around that neutralization of those memories that may be slightly more painful, that neutralization, is it almost sort of the medicine so we can move forward? So because I guess when we've got trauma or memories that aren't great, then sometimes it's difficult for us to move forward, because whenever we want to, there's something holding us back, and it prevents us from achieving whatever it may, whether it's it could be anything. I guess it can be a relationship thing, it can be a work thing, it can be a financial thing, it can be many, many different things. So this neutralization, is it enabling us to move forward in different areas of our lives?
Exactly. And it is medicine. I love what you said, because I always say that meditation is medicine. It's a medicine because the minute you meditate, and this has been studied scientifically, when we meditate, we come out of that back part of the brain, the amygdala, that's in survival. We start to access the prefrontal cortex, the part of the brain that is more creative, higher order thinking, and present time. So whenever you, like, say, drop that memory or it's transmuted, then when your creative energy comes back to you, there's literally a physiologic change that happens in the body. Our stress levels drop, right? Because we're not in that pain anymore. We're not in that fear or trauma or doubt, or overwhelm, or all those anxiety, all those things that we experience. So all that starts to neutralize, so that what happens is that our body starts to relax, and then you have literally more mobility, and you have more creative energy mentally.
Yeah.
So you can start, and then you can do something different. So the other thing to remember when we say hello is that maybe we did something in the past, but we don't have to do that right now. We have total power to be in the present time and to do something different.
Yeah, fascinating. So I was thinking around, so all this amazing work you've done before to get to the point where unfortunately you had to have this, well, not you had to, but you had this accident. So I'm thinking about you were well put together and able to deal with this. What about our nearest and dearest who might not be as well equipped to try and support us from a mental perspective, from I guess from maybe a supportive perspective, and I guess that's conversations, and maybe even emotionally they can struggle. They don't like to see our loved ones struggle, and so I'm just wondering how you or how we can manage those situations, because when we're going through a difficult moment, we might be able to handle it better than our nearest and dearest, and then we have to make sure that their kind of their way of dealing with the situation doesn't impede us.
You mean how? So if I understand you, you're asking when we're going through our healing journey, how are the people around us affected?
Yeah, so I guess what I'm saying, do we have to be careful if somebody else that maybe a loved one who's not dealing with it as well as us, it doesn't compromise us in terms of, you've got all the tools, all the abilities to
Yes.
navigate and move forward. But if our nearest and dearest who are around maybe don't quite have those skills, we just have to be mindful about managing them.
Yes. And that is such a profound question because I was so focused on my own healing because I knew I had to. I mean, I had to be like laser
Yeah.
focused. And what I didn't realize was how much my husband was being affected by it until I fully healed. And I have his permission to talk about this up to a point. He had his PTSD from Vietnam. So I learned a very profound lesson. So we worked through that, and his healing process took a while as well. But I was able to help him navigate because I had navigated it. So my lesson that I walked away with was when we're traumatized, when we're experiencing trauma, the people around us, our loved ones, are also affected. Now, what's tricky about that is that I had dedicated my life entirely pretty much to helping people, to helping other people first, but I had to put me first. So what I realize now is that and I love your question, know that you have to heal yourself and give them space to be in their process, whatever that is, because they're going to be scared. They're going to be hurting. They're going to be afraid of losing you. They're going to be afraid of, well, what if? And so the best thing you can do in that situation is just love them. Love them right where they are and love yourself right where you are. And try to get a sense of humor. Because humor makes all the difference in the world. A positive mindset. And a positive mindset. The other thing that is just key to this whole journey is gratitude. Gratitude, the power of gratitude is immense. So, because when you're grateful, you're amplifying what is working. And the universe, then the law of attraction can bring you more of what's working. So when we tell our loved ones how much we love and appreciate their help and their understanding. And I know I'm different, but I'm going to be okay. And just reassurance in a way that helps them, because you can't both go downhill. That's not good. That's not good for anybody.
Yeah, it's remarkable. So I'm talking to you, it's been amazing. We don't have nearly long enough to cover everything that I would love to cover with you, but I hopefully we've got a few more minutes, and then maybe we can definitely have another conversation. So, so just around this episode is around the ability to thrive after trauma. Clearly, you embody that, you're doing that. And for people that are experiencing some level of trauma, it can be, I guess trauma can come in many different guises. Do you have maybe a word or words of advice how they can maybe put in systems that they can navigate those difficult moments?
Yes. First, say hello to your wholeness. Say hello, and this really is foundational, because when you recognize your wholeness, that's where you start. So your body can start to relax, your mind can start to relax, because you don't want to go down the dark tunnels, because that will just take everything down. But if you can stay and remember that you're whole, like I'm going to start with my wholeness. And then from there, gratitude for what you have in the moment. So I couldn't raise a glass of water. Maybe I needed two hands, but I was alive. I was alive. And so every day, so from the moment I knew I had survived, that gratitude was so profound that gratitude is what got me through every day. And even though I couldn't do what I had done before the accident for years, I could do something more every day.
Yeah.
So if you can just appreciate what you can do, what you do have, and that you're capable of healing, that will set you up. And the other thing to remember is that the human spirit is indomitable. It cannot be stopped. So within you already is resilience. Your health is already in you, and your resilience is there. So if you can tap into your resilience, not from a place of pushing through, but from a place of your inner knowing of what you need in the moment. So listen to that still quiet voice that's guiding you. And if someone tells you to do something and it doesn't feel right, it doesn't seem right, listen to this part. And the other thing is forgiveness.
Okay.
Forgiveness, forgiving what happened, forgiving yourself, and knowing that you're free.
Okay. Okay. I love your answer. And just in line, I think it's kind of the same territory. So we have negative thoughts, particularly when difficult things happen. So if people are having negative thoughts, should we use the same techniques that you've just described just to kind of quell and to neutralize those negative thoughts when they arise?
Absolutely. And the other thing is, you can recognize it's a negative thought, right? We all do. I mean, except sometimes we go down that rabbit hole because we just keep going and going and like, don't go there. So I was in the emergency room right after the accident. And I said to my husband, if I had gone to that other Staples instead of taking longer at lunch, I wouldn't have been on the highway at the time that I was. And he's a decorated Vietnam vet. And he said to me, don't go there. And I went, you're right.
Yeah.
You're right. So every time I'd start to go there, I go, no. I just go, no, that's it. No.
Okay.
And look at something positive, not like a Pollyanna, like, okay, I'm going to ski today when I could barely walk. That's not, no, but today I can walk. So I can heal. I am healing. So that positive reinforcement mentally will actually increase feel-good hormones in the body that help you heal.
Okay. That's fascinating. And so before I forget, I want to, so for people that want to get in contact with you, find your podcast, find your website, where's the best place for people to find you?
My podcast is Health Conscious Living, and I'm on social media on Instagram and Facebook and LinkedIn, Gayle Myers, MD. And my new website coming out soon is healthconsciousliving.com.
Okay, perfect. So we'll put everything on the show notes. So it's very simple for people to find you. And you mentioned earlier that you ski now.
Yes, I do.
Amazing.
When we have snow, but apparently global warming really got
Yeah,
to us this year.
yeah. Okay, so
Not a lot of snow.
not that. That's another little challenge that we've got to navigate. And I do have a final question, which is the recurring question. So if you could invite three inspirational people for dinner, that can be alive or past, who might you invite?
Now, when I tell you who I invite, would I tell you why I would invite them, or just tell you the three names?
Whatever
Uh,
you feel comfortable with. So
okay.
the floor is yours.
The first person I would invite is Steve Jobs. And I would invite him to dinner, and I would ask him that when he had been a college dropout, but he was taking courses because he was learning and he was dreaming, and he saw they had this vision of creating a computer that had this beautiful color interface that was dynamic. And so he had a vision of how he would change the world. But my question to him would be, did you have any idea how much you would change the world? And look at it now. We have these devices that are there that, I mean, growing up, would I think that I would have a phone, a video camera, a computer? I mean, it has so many capabilities that I had no idea. But then how we communicate with it, I would ask him that.
Yeah.
That when he envisioned that one thing, and it was a big vision at the time, it was beyond comprehension, and now look at where it's gone. That's one person. The next person I would invite is Oprah. And Oprah has, I'm sure a lot of people say that. I mean, I've watched Oprah's journey from the beginning, and I just have so much respect for her. And I would ask her, she's been such a game changer for us in terms of positive affirmation of humanity and growth and soul growth. And the question I would ask her is, how do you want to be remembered? That would be my question.
Great question.
And the third, this came to me when I was considering this question. I would invite Jesus Christ to dinner. And I would invite Jesus, and I would say, you have changed the history of humanity. So all these three people have changed humanity in some way. You changed the history of humanity so profoundly. And you really had, in addition to the Lord's Prayer, you really just had two big messages. And I'm gonna sort of give it a little more wording, but to love God with all your heart, with all your soul, with all your mind, and your neighbor as yourself. If there's ever a time in history, we need to remember that.
Yeah, powerful. That would be an amazing dinner. I really enjoyed this conversation. I feel it's part one because there's so much more to your story and your journey that we simply don't have time to cover today. But it's been hugely inspirational and impactful. And yes, I've learned a lot. So thank you.
You're welcome. My pleasure. And you asked such great questions.
Well, I'm just fascinated by your journey, and it really gives us all inspiration that in those really difficult moments, we are hugely more capable within than most of us can even dream of. So I'm so pleased that you're doing the work that you're doing, because it's really given us really access to our fullness, our whole. I think you used the word when we spoke, our wholeness. So yeah, so it's fascinating. So yeah, so definitely want to have another conversation with you. So thank you so much.
You're welcome. I'd love that. Thank you, Paul.
Thank you. And thank you everybody for tuning into this episode of My Perfect Failure. Always looking to grow the show. So if you listen to this on YouTube or even watching, please do subscribe and your feedback is most welcome. So keen to hear about the things you like and equally the things you don't like. So you can find me at paul@myperfectfailure.com, or you can find me via the contact page on the website. So take care for now. Bye.
Thanks for listening to My Perfect Failure podcast. Be sure to visit www.myperfectfailure.com to join the conversation. Subscribe to our podcast on iTunes or Google Play. Look out for our next episode.